So we now have Gauri Thapa from the Universities of Greenwich and Kent investigating the long-lasting neurological complications of COVID-19 and the risk of developing dementia.
Hi, I'm Gauri Thapa. I am a second-year PhD at Medway School of Pharmacy. So my research focuses on the impact of COVID-19 on individuals. Most of us here have had COVID and have recovered from it, but there are still 2 million people in the UK who are still recovering from COVID. So this is also known as long COVID. Long COVID encompasses around 200 symptoms and then affects multiple systems of our body, among which the neurological symptoms is very common. So these symptoms include depression, anxiety, lack of concentration, so which also happens to be the hallmarks of neurodegenerative diseases. That is why these symptoms in the future may lead to diseases such as Alzheimer's. Since there is no cure for long COVID, it is very crucial to find the risk factors. So I currently have 3 ongoing studies. So first is the survey to stratify the population. Second is the genomics to find any genomic association. And third is the brain study to look at macroscopic and microscopic changes in the postmortem brain. So this is a part of my survey study. We can see that there is a 1.5 times higher odds of getting neurological symptoms among long COVID individuals. If we look at the breakdown of the neurological symptoms, which is highlighted in blue, the odds of getting lack of concentration, headache, dizziness, along with changes of smells. Some of the people who lost their smell during COVID have not regained it. So when we look at the frequency of the symptoms in long COVID cohort, the frequency is higher in the severe category, which is all highlighted in yellow, whereas if you look at the subacute and subacute COVID, it is higher in the no symptoms category. So we will further investigate these neurological symptoms with risk factors such as demographics, environment, and genetics. I'd like to thank my supervisor, Dr. Romina Vono, Medway School of Pharmacy, University of Kent and Greenwich, University of Cambridge, and UK-ICN for giving me this opportunity. And my poster is poster number 12, and if you want to participate in my study, please scan the QR code. Thank you.